I'm Dr. Dan Uslan, Clinical Chief of Infectious Diseases at UCLA Health. A lot of people have been asking me what is a coronavirus. Coronaviruses are a large family of viruses that can cause anything from a mild upper respiratory infection like the common cold, all the way to severe lower respiratory infections like pneumonia. You may remember hearing about severe acute respiratory syndrome, or SARS, and more recently Middle Eastern respiratory syndrome, or MERS. The current outbreak of coronavirus in Wuhan, China is of the same family as those other coronaviruses. The symptoms of the Wuhan coronavirus can range from mild upper respiratory symptoms to severe lower respiratory symptoms, such as pneumonia, fever, difficulty breathing, or shortness of breath. In some cases, patients have developed respiratory distress, kidney failure, and even died. While presently there is no vaccine or cure for the Wuhan coronavirus, treatment is supportive. What that means is that patients can be supported, for example, with intravenous fluids or put on a ventilator to support their breathing. A lot of people have been asking me if the Wuhan coronavirus can be spread from person to person. So far, based on what the CDC and the World Health Organization have told us, it does appear that there is transmission from person to person. A lot is still being determined about this virus, and new information is available every day. While at this time there is no vaccine for Wuhan coronavirus, there are some steps you can take to protect yourself. Be sure to wash your hands regularly and to cover your nose and mouth if you sneeze or cough. If you're sick, stay home from work and avoid going out into public places. If you've traveled to Wuhan, China in the last 2 weeks and think you might be infected with Wuhan coronavirus, please let your doctor's office know before coming in for an appointment. Some of you may be wondering what the difference is between the Wuhan coronavirus and garden variety flu. We are in the midst of flu season, and it's important to do everything you can to prevent getting the flu, including getting vaccinated if you have not already. The symptoms of the flu include headache, cough, high fever, and muscle aches. Wuhan coronavirus is only a concern if you've traveled to Wuhan, China in the past 2 weeks and have symptoms of cough, shortness of breath, and fever. UCLA Health is well prepared to care for a patient with an infectious disease such as the Wuhan coronavirus. We have a team of infectious diseases specialists and emergency preparedness personnel who've been training for years to take care of patients with complicated infectious diseases, including new ones like this one. We have processes and protocols in place, personnel trained, and all the equipment necessary in order to provide safe care. There are a lot of other viruses this time of year, including influenza. And the good news is that there's a vaccine for influenza that is safe and effective. Remember to get your flu shot every year, to cover your nose and mouth when you sneeze or cough, to stay home from work when you're sick, and to wash your hands regularly.